For decades, glaucoma care has followed a similar pattern. We start with drops, then we add more drops. We maximize drops. And only much later, sometimes far too late, do we think about laser or surgery. But glaucoma care has changed. Our patients have changed. And our tools have changed. The question is, has our mindset changed? Hello, my name is Dr. Constance Okeke, and today we're going to talk about what I call the interventional glaucoma mindset and why embracing it earlier can fundamentally improve how we care for our glaucoma patients. This editorially independent video series is supported by Glaukos, Iantric, New World Medical, and Sight Sciences. The interventional glaucoma mindset isn't about doing procedures for the sake of doing procedures. It's about being proactive instead of reactive. It's about recognizing that glaucoma is a chronic progressive disease and that relying solely on medications year after year places a heavy burden on our patients. Most importantly, it's about offering patients choices rather than making assumptions on their behalf. And I want to share two real experiences that completely changed the way I practice. The Cataract survey that changed my thinking. Several years ago, when I was early in my MIGS journey, I conducted a simple survey. I asked patients who were in my clinic before being evaluated for cataract surgery and who also had glaucoma a very straightforward question. Are you okay with your glaucoma drops? The majority said yes. And if we stop there, you might assume that everything is fine, that drops are working, and that there's no reason to intervene. But I asked a second question. I asked, if at the time of your cataract surgery, you had the option to have a safe, minimally invasive glaucoma procedure that could reduce or even eliminate your need for drops, would you be interested? The answer was overwhelmingly yes. That moment was eye-opening. These patients weren't necessarily struggling in obvious ways, but when offered a choice, they showed strongly preferred fewer drops, less burden, and more consistency. That survey was later published in my book, The Building Blocks of Trabecular Surgery, and it fundamentally changed the way I thought about patient care. Because what it showed was simple but powerful. Patients don't always know what options exist unless we offer them. And if we don't offer those options, we may unintentionally be doing them a disservice. I shared this insight with one of my colleagues, a cataract surgeon, who realized in that moment that he had been assuming what patients wanted. He changed his practice and began referring his glaucoma patients for MIGS evaluation at the time of cataract surgery. That is what a mindset shift looks like. The parallel to cataract surgery choices. If you think about it, we would never assume that a cataract patient only wants a standard lens. Today, patients are offered options, premium lenses, toric lenses, customized solutions, because we recognize that value isn't always obvious on the surface. So why would we assume that a glaucoma patient who seems fine on drops wouldn't want an interventional option? Choice matters. COVID and the reality of drops. The second experience that solidified this mindset came during the COVID pandemic. Many of my patients simply couldn't get their drops consistently. Some ran out, some couldn't access pharmacies, some stopped taking them altogether for months, and in some cases over a year. And what I saw was heartbreaking. I saw dramatic visual field loss in patients who had previously appeared stable because drops only work when they're taken consistently. And the same time, I saw something very different in patients who had undergone interventional treatments like SLT or MIGS. I saw that their disease remained stable. Their vision was preserved. Their care didn't collapse when life became unpredictable. That contrast made one thing very clear to me. Drops are not always a safety net, but interventions can potentially be. These experiences reinforce something critical. The interventional glaucoma mindset isn't about replacing medications. It's about building durability into care. It's about recognizing that earlier intervention can reduce medication burdens, improve consistency, protect patients during life disruptions, preserve vision over the long term. And this is where modern tools truly matter. Today we have an expanded set of options that allow us to intervene earlier and more thoughtfully across the entire glaucoma spectrum. That includes being intentional even with medications we choose, such as once daily more effective therapies, preservative-free formulations, and combination approaches, because how we start treatment can shape long-term success. But intervention doesn't stop with drops. We now have non-topical drug delivery options, laser therapies, and minimally invasive surgical tools that allow us to reduce treatment burden while maintaining flexibility for the future. Trabecular meshwork-based approaches, sustained drug delivery platforms, canal-based systems, and emerging cyclomodulation techniques, they all play a role in modern care when applied thoughtfully. These are not last resort options. They are foundational tools in a contemporary glaucoma care pathway, tools that can be layered, combined, and personalized over time. Understanding how and when to use them is exactly why the Interventional Glaucoma Tool Chest video series exists. In the upcoming videos, we'll break down the tools in the Interventional Tool Chest, what they are, how they work, who they're right for, and how to thoughtfully integrate them into your practice. We'll also step back at key points in the series to address the bigger picture, exploring common barriers to adoption in the interventional glaucoma and how to overcome them, as well as why effective co-management between ophthalmologists and optometrists is essential in modern glaucoma care. If you'd like to continue learning, I invite you to subscribe to the iGlaucoma YouTube channel and explore the end screens and cards for curated playlists and related videos that go deeper into many of these topics. In the next video, we'll begin by focusing on drug delivery and procedural pharmaceuticals, an important entry point into the interventional glaucoma mindset. Because when we shift our mindset, we change outcomes. See you there.